Hey guys, Jarethsmith here, and today I'm going to be talking about Kohler disease and clubfoot. So I got a question from one of our viewers on tips on how to improve Kohler disease and clubfoot. Now, Kohler disease is a rare bone deformity where the blood supply is temporarily cut off from the navicular bone of the foot, causing the tissue to break down and deform. Now, this causes pain and swelling on the medial aspect of the foot, which makes it very hard for the person to walk on that medial side. This means that the patient usually walks on the lateral side, which is probably why you're getting this clubfoot state. Both these symptoms or diseases are common in small boys, young boys. The only tip that I can have for Kohler disease is to eat a diet high in anti-inflammatory foods such as berries and citrus fruits, anything high in antioxidants. What that's going to do is reduce the swelling and reduce the pain, and over time the navicular will heal and repair itself. Now, for clubfoot, there are many things you can do. The first thing I want you to do is separate your toes, because you'll find with clubfoot your toes are very pressed together, and you want to get your fingers in there and just separate the joints out and stretch the muscles. The second thing you're going to want to do is the same sort of thing, but it's called splaying of the feet, which is essentially the same sort of thing, but you're using your muscles to actually separate the toes rather than stretching the muscles yourself. Now, you can do multiple repetitions of this, but at first it's going to be very difficult, so stick with it and then you'll get it over time. The next thing I want you to do is myofascial release, or stretching of the calf or the posterior tibia. What this will do is release all them muscles which are going to pull you into that supinated foot, and inverted foot. So release all them. What you can do for this is just get on a foam roller or a massage ball, or just do some simple stretching to release that. The next thing is going to be a really good thing for you to do, but you need a partner to do it, for someone to do it for you. What they're going to do is put their hand over the top of your foot and grab your heel and then pull on the heel so it separates the joint out. What this will do is increase blood flow to the navicular so it can repair quicker, but also then I want you to push the toes towards your body, and this will stretch all the muscles in that posterior compartment and help release those muscles, so then you're not getting this clubfoot as much. Okay, so the next two things I want you to do are exercises to strengthen up the muscles on the opposite side. So these muscles are going to improve your dorsiflexion and your pronation, which is the opposite of clubfoot, which is the posture that we want to strive for. So the first one's going to be walking on your heels. Now, you can do this for 30 seconds at a time, a minute at a time, it's completely up to you. Do it daily, but this will strengthen up all the muscles in the anterior compartment, mainly the perineal muscles and also the extensors, which are going to cause dorsiflexion and then that pronation, which is the opposite to clubfoot. The next exercise I want you to do is foot circles, going to the outside of your body. Again, this is doing the same thing, strengthening up the feet, strengthen up those muscles that you need to strengthen up to get rid of this clubfoot posture. Alright, I hope this video helps you. If it does, leave a comment down below, like the video if you haven't already, check out my channel for more content, and I'll see you all in the next video.